Neighborhood Health Watch is sponsored by the doctors of HCA Virginia Health System.
Up for discussion today in Neighborhood Health Watch, irritable bowel syndrome. Not a pleasant topic, but an important one. It affects 10 to 15% of the population, and yet the number of people seeking medical help is fewer than 1 in 5. The signs and symptoms can vary person to person, but the common ones are stomach cramping, bloating, the bloated feeling, gas, diarrhea, and constipation. Dr. Harjit Bhogal is a gastroenterologist with Henrico Doctors Hospital, Forest Campus, and you're here to talk a little bit more about this. Some of the symptoms that we just listed are quite common. They happen at some time or another.
Absolutely.
How do you make that diagnosis, though?
Thank you. That's a great question. So typically with irritable bowel syndrome, the diagnosis is made if this is a chronic condition. And typically patients will have these symptoms ongoing for at least 6 months. And when we talk about the symptoms, the most common way we diagnose this is based on symptoms. There are no blood tests or x-ray tests that make the diagnosis, but rather the story that patients tell. Typically, patients will have abdominal discomfort or pain, which is associated with a change in bowel frequency or character, and often even relieved with bowel movements.
What causes irritable bowel syndrome?
There's not one specific thing that may cause irritable bowel, but there are a few different schools of thought as to what may contribute. 2 of those include a change in the brain-gut axis, and the way that our gut and our brains talk to each other can sometimes be altered in patients with irritable bowel syndrome. The other thought is that there may have been an infection in the past that may trigger irritable bowel syndrome.
And what about risk factors? Who's most at risk? I read before coming out here that women is a high-risk category. Why is that?
Right, that's a great question. So women definitely do suffer from irritable bowel more than men. It's probably about 2 times as common in women than men. There may be some differences in the way that our brain and our guts are wired, and there may also be some hormonal changes that can contribute to that.
And what are your treatment options?
There are a variety of treatment options. So first and foremost, I think about foods that we're eating. And in some folks, keeping a high fiber diet to help regulate the bowel movements may help. In other people, there are certain diets. One particular one is called a FODMAP diet, where there are certain foods or carbohydrates that may contribute to the symptoms, and that's something to talk about with your physician.
All right.
And sometimes people need to be on medicines to help with the cramping or even to help with changing the quality and frequency of their bowel movements.
Dr. Bhogal, thank you so much for joining us on First and Forward.
Thank you so much for